Hello everybody, welcome back to Tuesday Tips with Back to Health. My name is Dr. Gleb Kartsev. I'm working with Back to Health for over a year at the location 2148 Ocean Avenue, Suite 301. Today I would like to bring your attention to shoulder pain and how you can deal with the shoulder pain, and also what I do in the early recovery. Surprisingly, this is the same basic exercise that will be appropriate when you're initially starting to experience like some type of the shoulder pain, and also when I start to work with the patients who's on the early stages of their recovery. I also recommend those exercises for the home exercise program. First of all, they are directed to improve the blood flow and blood circulations in the area of the shoulder. Today I'm going to give an example of the right shoulder. For example, when you can use it at first, if you have a little bit ache, discomfort, or like initial clicking, that's a very basic one, and something that you may try to improve yourself. But by any means, if you have any pain, any discomfort, please speak to your physician or physical therapist as soon as possible in order to prevent any development or exacerbation. At this point, we're going to discuss the isometric exercises for the rotator cuff stimulations. So there's a series of the basic motions, which is abduction, so bringing a shoulder to the side. External rotation, so from neutral, we're going to be discussing neutral as this position. It's about 90 degrees between your forearm and the torso angle, and also slight abduction, so bringing to the sides almost 30 degrees. It's an angle between the shoulder and the torso as well. This is your neutral position. Isometric exercise, it means no motion. And first of them, it's going to be external rotation. So you always want to put a little fulcrum to compensate for the 30 degrees of abduction under your armpit. So today I'm using a towel. Make sure it's tight, it shouldn't be too soft. You place it comfortably under your armpit, and you got your neutral position here. Now, because it's external rotation, that's going to be motion here. You don't want to push it too far, like just a demonstration purposes. Then you approach the wall. You're standing to the wall, and your touching point is going to be your knuckle or back of your arm. So now I'm trying to perform the motion that I demonstrated earlier. I'm pressing in for about 5 seconds, and I can repeat it up to 30 times. I would like to feel slight tense up of my infraspinatus and teres minor in the back of the shoulder. So it's going to be somewhere here you might feel. If you feel pain, that means you're pushing too hard. So in that case, just relax your pressure. As I mentioned in the beginning, this is for the circulation. This is not to cause hypertrophy and develop like bigger muscle size. So we're just using it for blood circulations to deliver the nutrients into the area. That's why please don't overdo it. Do it lightly and don't cause yourself pain more. So you're pressing for 5 seconds and you relax. When you relax, you don't bring back your hand, you just keep it here. Press, relax. So let's do 1 repetition fully. Press, 1, 2, 3, 4, 5. Relax. This system is going to be used for all the further exercises. So next exercise is abduction. It's bringing the hand to the side. It's same position, only one difference. I'm not using the fulcrum because I may lose it if there's a little bit of the motion. And I'm also trying to perform motion like this. But because of the wall, I'm not going to be able to do it. And we don't press hard. So press 1, 2, 3, 4, 5. Relax. Usually we're looking to activate the supraspinatus. It's a muscle on top of the shoulder blade, and a little bit of the delt, primarily lateral part of it. Also, we can flexion and extension, so pushing forward and back. I'm going to be using my left. I'm at my neutral here, so slide 30 degrees to the side from the torso, 90 degrees towards the torso between my forearm. So press forward. You see, I'm not leaning into the wall, I'm not pushing from the wall. I'm standing in the same place and I'm just pushing forward. 5 seconds. 3, 4, 5. Relax. Relaxing, hand still stays at the spot. So how we would do extension? Almost same. Next to the wall, I'm in my neutral position. Press back. 5 seconds. Relax. Press back. 5 seconds. Relax. Also, all of it you can do up to 30 repetitions. So right now I'm going to demonstrate you internal rotations. I'm getting my neutral position to the door, not pushing it in, but actually my neutral. I'm stepping in and positioning myself that I'm having perfect starting point. Also, press for 5 seconds and relax. 5 seconds, press, relax. Press, relax. So remember, no motion, so make sure you use either wall or door to get it like stable. Make sure nothing moves. If you feel aggravation after the exercises, use the ice pack for 10 or 15 minutes over the paper towel or thin towel, so to avoid the frost bites. With that said, if you have any questions or comments, please comment below. If you like this video, please share with your friends. I'm sure some of them may use it. And you can always find us at Back to Health.